Ashlyn. Ashlyn is going to be here today to film a chiropractic video with us. She's got an incredible story, and she's going to walk us through a little bit of that right now, and then you guys will get to see her treatment on camera today, and you'll see what it is that she's gone through for the past 5 years, really. 18 years old now, right? Mm-hmm. And she was 13 when she got diagnosed with scoliosis. And how did that exactly happen?
I was growth hormone deficient. When we found that out when I was 10, so I started the injections for that, and I grew about 6 inches in a year, which is pretty drastic. And I actually had a director come up to my mom and say, I just want to tell you that we're doing a shot of her from behind, and her one shoulder is in frame and the other one is not, and you just might want to go get her checked out for scoliosis. Got an x-ray, and I had a lower lumbar curve. I believe it was about like 18 to 24, something like that. Braced for a while, hated that.
What was the brace? Like the big
Yeah,
brace?
I had it. It was up in both in my armpits, and then came down over my hips, and then I had a pelvic tilt forward as well. But yeah, it was one of those that you strapped. I wore it 24 hours a day, only took it off to showers, took it very seriously, and my curve just continued to progress. And after about a year in the brace, we kind of said, like, it's not really worth it to be in this much pain and to be sweating constantly. I had to wear like an undershirt because it would chafe, and it was just not fun. So I stopped bracing, did a bunch of chiropractic care, Scoli Smart, I did Scroth physical therapy, nothing was working. And then at about 15, my curve had progressed to about 54 on my lumbar, which is at the point where you need to consider surgery. Mm-hmm. And then I had started developing an upper thoracic curve, which was, I think, at the end, or in like the 20s, and I had gone to Shriners Hospital, Dr. Lang, and he had kind of broken it down to me like, yeah, it's only progressing about 5 degrees a year, but if it progresses 5 degrees every year for the rest of your life, you're going to be in a wheelchair by the time you're 25, so that was what made me pull the trigger. And then 6 months later, when I got my surgery, L4, which we didn't plan on fusing, was completely tilted to its side, so I'm glad we did it. I'm very happy with my results.
And what's the fusion?
T9 to L4, so here to here, basically.
Yeah, like T9 is like one of your thoracolumbar vertebrae, and then down to L4. So you guys will see a picture, we'll put it up on the video, but she's got rods up and down her back, and screws at like every level.
I have 18 screws.
18 screws. So a lot of hardware in the spine, the thoracolumbar spine, from T9 down to L4. We met Ashlyn post-surgery probably 2 years ago now.
Yeah, I believe it was November 2020.
Yeah, and so she's an awesome success story because she had surgery, she had a severe scoliosis, she underwent chiropractic care, physical therapy prior. Unfortunately, it couldn't help. Went with the surgery and still following up to this day with regular chiropractic care, back to exercise, right? So she's doing a whole bunch of high intensity exercise. She's not letting her scoliosis and her surgery or subsequent surgery affect her life moving forward anymore. She's still staying super active, and now we have her on a good rehabilitative protocol with some of the go-to coaching exercises, the rockers, and the proper technique for the upper body movement to help reduce any ongoing tightness, pain, tension, irritation, vertebrae misalignment, and promote optimal movement on a day-to-day basis, right? So she knows she's got, at 18 years old, right? That's how old you are? Mm-hmm. 18 years old right now. She's got a whole long life ahead of her. She's going to stay in this proactive mindset. She's eating well, she's exercising well, she's getting regular adjustments, and you guys are going to see how we adjust the patient with rods up and down the back. We'll show you what the scar looks like from the surgery, and then we'll put up a picture of what her x-rays look like so you guys can see that it is possible and it is doable to continue with rehabilitative conservative care as well as a good exercise program so that we can stay healthy and mobile throughout life, right? Don't let your surgeries, don't let your scoliosis, your hip surgery, your shoulder surgery, whatever surgery it is that you have, you can find a practitioner that can work with you to establish a good exercise routine as well as ongoing supportive care to help reduce aches, pains, discomfort, and stuff like that. So some issues that Ashlyn's been dealing with subsequently, recently, kind of like some tendonitis in the forearm flexor. We'll do a little bit of Graston therapy or a little bit of instrument-assisted soft tissue work up and down the extensor compartment. These muscles, they kind of pull up into the right side neck, and she gets a little bit imbalanced up in the right neck and the right shoulder. So what we've worked on is some mindfulness in posture, some different exercises where she can work on some side bending, some lat activation, and helping to reduce tension up in the neck, the upper trapezius muscles, the suboccipital, some of the stuff where she commonly gets restricted up here in the C1, C2. Cool. In the gym, which is awesome because we get to train her a couple days a week, plus we get to adjust her, but in the gym we've been working on running technique and getting her shoulders to open up, and I mean,
much better running.
Yeah,
I could not run before at all, so I'm very happy with that.
Yeah, and we, you know, part of what we do is sync your brain up with your body so that you learn how to move in the right movement patterns. And you know, you should see Ashlyn on the treadmill now. She can power through. She can get her arms into it, her shoulders into it. Even though she lost, and she will never have back, the rotation and some of the lateral flexion throughout the lumbar spine, she's still doing an amazing job at keeping the surrounding segments nice and loose and healthy so that they don't undergo hyper or hypomobility changes from that loss of, you know, correct movement down throughout the thoracic spine.
Yeah, that was something that was really cool with the hospital that I went to. They did testing pre and then right after, and then about a year later after my surgery, flexibility testing. So I lost immediately after my surgery, I think it was 6 weeks after, I had lost about 50% of my mobility overall. And I like to tell people my limitations are kind of like a pregnant woman, like 6 months pregnant. I can't really bend my midsection that well, but then I went back for my 1 year checkup and they were really astonished because I had gained back 20% mobility, which is not common at all. And I really think that has something to do with the fact that I come here, I get adjusted, I work out, and I was doing pre-surgery and post-surgery physical therapy, which is not something that they usually prescribe. I had to ask for that. So make sure that you're taking initiative.
Yeah, take initiative and stay focused, stay healthy, stay mobile. Don't just give up. Don't just say, oh, I had this scoliosis, I have this surgery, I can't do these things. Some doctors will tell you that you can do things, and some will say, oh, stray away. She's doing deadlifts in the gym, she's doing back squats in the gym, she's doing kettlebell work, all kinds of running, and a lot of mobility work over in the fitness facilities.
Yeah.
Cool. Let's get started with treatment, right?
All right.
All right, guys. Ready? Cool.
Yep.
All right, guys. So as we start off with all of our patients, we do our upper extremity, our upper thoracic, our midsection check, and Ashlyn has a little bit of irritation, a little bit of imbalance up in this right side, the right rib cage, right T1 vertebrae, T2, T3, T4, kind of like moving right down into the levator scap, the medial border of the shoulder blade right here, the supraspinatus, and then she's been having some irritation, some wrist, a little bit of wrist pain, a little bit of wrist weakness in the extensors, and a little bit of imbalance in between the extensors and the flexors. So you guys will see a little bit of soft tissue treatment up in the neck, the mid-back, and the right shoulder, and then you guys will see how we do a little bit of soft tissue release down in the wrist. Okay? And then a common spot for people to have is like this upper cervical C1, C2, C3 area. And she feels that little bad guy right there, which is something that we will continually adjust on I don't want to say a frequent basis. Ashlyn likes to come in once every week or 2 weeks for a tune-up. It helps keep her mobile. She recently just started a new nannying position.
Yes.
And so what you've done in the gym has helped out a little bit, right?
Mm-hmm.
She's been lifting, you know, some weights, some kettlebells, and now she's taking care of a 9-month-old.
Yes.
Kind of like full time, right?
Yeah, Monday through Thursday.
Monday through Thursday, so she's in charge of lifting, carrying, feeding, playing.
Pushing in the stroller.
Pushing in the stroller. And, you know, so your day-to-day activities, your ADLs, your activities of daily living, they change constantly depending on your job or what you have to do at home, activities that you've got to do around the house, all that good stuff, right? Mm-hmm. Establishing good lifting technique for somebody with or without scoliosis is super important. And, you know, maintenance care, kind of chiropractic care, look down for me. Or supportive, what we call supportive care. Ashlyn, if she chooses to, will undergo a lifelong path to supportive care where she continues to get adjusted, she continues to stretch and exercise to keep her body healthy and mobile. And again, like we said in the beginning of the video, not let the prior surgeries slow her down? And since I've known you, man, you've just been speeding up, right?
Yeah, it was something that I just was so sick and tired of feeling like I couldn't do things because the pain was really, really bad. I mean, I was at an 8 or a 9 every single day just from muscular pain alone.
Mm-hmm.
And that was another driving factor for me. I was just like, I cannot be in this much pain for the rest of my life because I'm someone who, I go. You know what I mean? Like, I'm always doing something, and I can't let that tie me down.
Nope. Look up, look down, look down, look up, look down, look up, look down, look up, look down, look up, look down. And I know on YouTube you guys have seen our videos before, and maybe, hopefully you're not bored of the muscle work in the upper back and the upper neck, because it is so important for people to have some of these upper thoracic and upper extremity muscles stretched, loosened, calmed, treated for some stress buildup. Look down, look up, look down, look up, look down, look up, look down. And when we started with Ashlyn, man, she was like all contracted on this right side. Neck was all kinked. Passive chiropractic therapy is, hey, come in, get adjusted, see you later. Active chiropractic therapy is, hey, come in, get adjusted, but do these exercises and stretches at home and take a little bit of control of your health while you're outside the office. All right, now we're gonna hit left side. I'm gonna pull this down a little bit.
And you guys do so much massage that I had never gotten that before. It was always just about adjustment, goodbye, like 5 minutes, you know?
Yeah, and different kinds of chiropractors. So, you know, we're a little bit more here, a little bit more sports rehab focused. We definitely take into account the soft tissue complaints, the soft tissue imbalances. And really where the soft tissue imbalances kind of eliminate, they go away, is when you become mindfulness up in the brain about how you're walking, about how you're standing, about how you're moving, how you're running, how you're lifting, being conscious that you're doing things with good technique, good form. And that's where we really stress the importance. This is a 2-part process. The 2 parts, it's me and it's her, and it's her and it's me, and it's, hey, let's work together to establish a good exercise routine. Let's establish a good standard of care, a good adjustment frequency, as well as, you know, kind of like me coaching her on her appointments. Hey, you doing this stretch? Are you doing this exercise? Make sure you stretch your fingers out, your wrists out. You keep your body, you know, kind of functioning at its best. Let's scooch forward for me a little bit. Hands behind you and palms down. Nice. And one of the things we want to work on is creating a little bit of that thoracic extension and a little bit of the shoulder cutting left and a little bit of the shoulder cutting right. On the left side, you guys can notice how her left elbow is like really hyperextended and nice and locked out. And then if we do the right side, you'll notice how we have to kind of like, if we say focus on this elbow, she can pump it up a little bit more to access a little bit deeper tricep and a little bit deeper posterior shoulder musculature up here in this, what we call the back corner. So like the teres minor, the infraspinatus, the posterior deltoid, we really want to kind of like torque or twist, and then we want to torque or twist this left side open, and this left elbow, straighten it out a little bit longer. And she can focus on the tricep and get the hand and the wrist nice and long here, nice. And this is one of those exercises, you know, she's again fused from T9 down to L4. And this is one of those exercises that'll help keep some of the upper thoracic, T9 and above, the upper thoracic vertebrae mobilizing, moving, manipulating, stretching, bending, twisting in a nice pattern. Nice work there, dude. Okay, cool. Let's go face down on the table for me. Let's get back into it. We got Bree's going to show you guys how Ashlyn right through here has a little bit of rib imbalance, a little bit of elevation of the right side of the rib cage. Do you mind if I raise your shirt up to about here? And then we're going to pull this up, okay? And Bree can zoom in and see what a scoliosis surgery looks like right down through here. So the doctors at Schreiner Institute, right?
Yes, Dr. Wayne.
Slice down through here. They put 2 rods to straighten out the spine. The scar is called keloid formation. And so we are going to do some muscle work up and down the erectors And gradually you guys will see a nice little red reaction that happens, the blood flow that we get back into the soft tissue around and on the incision, right? And she's got a little bit more keloid formation down here. It's a little thinner up here. But again, just kind of pay attention to how this right side rib cage is a little more elevated. Now, when we do have hardware in the spine, hardware, screws, nuts, bolts, and rods, everything is fused together from T9 to L4, which at some point she can still have muscle-related, joint-related back pain. And you guys will see right through here, just with a few light pressure. We're not pressing super hard. But you guys can see how this tissue around the scar is just asking for healthy blood flow. And what we do here is just a little bit of myofascial release, or sometimes just called muscle stripping, right up and down through here. And you feel that little, how's that feel? Is that 0 out of 10 pain, or is that 8 out of 10 pain?
No, it's not that. I'd say like a 3 or 4.
3 or 4. So we feel right through here.
It just feels tight.
A little bit of scar tissue, and you guys will see the spot pop out right there that we're talking about. So what we use, a little somber lotion. A little somber lotion helps us to reduce the friction of the skin and allows us to get a little bit deeper treatment into the fascia and the connective tissue. And we're going to focus right through here. You feel okay with this?
Mm-hmm.
Does it feel good or bad?
It doesn't feel great, but it's not painful. Obviously, with a scar this big, it's sensitive.
Yeah.
But it's nothing I can't. It's not.
That's actually a good point to talk on, is that scar sensitivity can affect people long term, from something as simple as a 1-stitch surgery or a 100-stitch surgery. When they stitch your skin back together, you can develop altered neurological function or control of the muscles, but also altered hyper or hyposensitive tissue. And so for many people, they might have surgery, and 6 months or a year down the road, they say, oh, that area still hurts so bad. And once we do a couple sessions of soft tissue treatment, the pain automatically goes away from stimulating the growth of new blood passageways, new arteries, new veins. And that's actually what we're doing right here. We're kind of mashing out some of the damaged soft tissue. And her awesome healing capabilities of her body are going to help to rebuild, regrow, or even just initially grow some new arteries, some new capillaries, some new veins down under the tissue to reduce stagnant blood flow. Cool? Let's hit down here a little bit too, right here on this side.
And I never had like where it would ache or anything like that, but it definitely, for that testing, they had to tape a bunch of stuff onto my back, and I just remember how painful that was when they had to pull it off the incision. I was like,
what, the tape?
Yeah, the tape. So things like that is what's sensitive.
Yeah. You know what? Let's do a little today, which we have not done in a long time. Let's do a little fascial release and see if we can get a little more to pop out here. I'm going to go real light over here.
Okay.
Guys, what we're going to do here, we're going to treat this scar a little bit more in depth than what we do on some of her last appointments. What I'm going to do, I'm going to tissue drag, and we're going to go real light over the scar, over the keloid, the scar tissue. We're going to see if we can get some nice petechiae to break out. You okay here so far?
Yeah, this is fine.
And so this technique, when we do this instrument assisted, what's called IASTM, this is an instrument. Today we're using the rock tape rock blade. This is a nice, it has like a double, what's called a double beveled edge, which is like a double-sided, kind of like, almost like a knife, but it's really, it's not sharp, it's dull. And you don't have to apply a lot of pressure, just real light pressure to help us, almost like shaving hair off your body. This is like shaving the scar tissue down, and we're going to get a nice little breakout right there. We see one starting.
The scar was something I was so nervous about.
Oh, dude.
I just thought I would hate it. I was like, this is going to be awful. And I was like, I'm going to look into tattoos to cover it and all kinds of stuff. And then I got it done and I was like, no, I'm really proud of this.
Yep.
This is a really painful thing that I just went through. And it's going to fade. And I love it.
Yep.
Now I buy dresses to show it off.
Yeah, that's a good point too. You got to own who you are. Right?
I feel like so many people are embarrassed of it. And it's like, no, I did. I'm proud of how I handled myself through this.
Oh, and how much did you grow as a person,
Exactly.
right?
Because it was so scary.
So scary. At 13 diagnosed with scoliosis, 15 surgery.
Because
Huge.
immediately after the diagnosis, they already started talking about surgery, and that was something I was not ready for.
Yeah. So guys, above the scar, these are all still free moving vertebrae, right? Occiput's up here, 7 cervical vertebrae down to T9, so we've got 8 thoracic vertebrae that still have healthy joint motion. The joints are still able to be adjusted. So we're going to adjust everything from CO down to T8. We may get the right SI joint. She's really flexible down in her feet and her lower extremity. All right, so a couple things that we noticed with Ashlyn, and she has progressed hugely with some of her rehab exercises, but her right ankle, her right foot, and her right hip are the ones that just don't, it is the one, I should say, the side that just does not internally rotate as well as the left side, right? So left side bounces a little bit easier. You can see the position of the foot, the leg here, versus how the right side is a little bit more downward, so we can kind of twist her ankle a little bit. But she feel how this side is like a little looser than this side.
Looser,
so much. So she's got this tension, this torsion, this twisting down this right leg, and that all starts up in the right side of the hip, the right side of the low back, the right rib cage we kind of pointed out. Unfortunately, she's never going to gain that full right side rotation through the spine, that full rotational capability through here, because she's locked up. So lifelong now, it's like, hey, stay where you're at here, continue to gradually improve the internal rotation, the twisting of the right knee, the right hip, and the right foot down and in like this versus the left foot. So as she walks, we want to make sure that she pivots off the left and pivots off the right. And those are some of the things that we're working on over in the gym, making sure that she is kind of landing on the green dot, then spinning around it, and landing and spinning, and landing and spinning, so that she can get that iliopsoas musculature, the front hip musculature, the rectus to stretch, and the glutes and the hamstrings on the side to activate. Nice. And then, as we do with her, we're going to hit this right SI joint, the right glute down into the IT band a little bit, help flush some of this tension down into the leg, down into the calf, get stronger foot, stronger plantar fascia, so that we have less tendonitis, less IT band issues, lateral knee pain, sometimes medial knee pain, sometimes plantar fasciitis, Achilles tendonitis, all those different diagnosis terms for muscular and tendinous dysfunction. And we'll show you guys on this picture right here about how the glutes are oriented and some of the deep 6 external rotators of the hip. The glute medius, the glute minimus, which attach to the sacrum right through here, the upper iliac crest, they kind of attach down here to the greater trochanter. So if you've heard of people that have had hip bursitis is where the muscles in the hip get extremely imbalanced. The bursa swells up. The bursa, which is these little like fluid-filled sacs down in your hip that can get irritated. So this is treatment for bursitis. This is treatment for gluteal tendonitis, iliotibial band syndrome, knee pain, foot pain, ankle pain, low back pain.
That was a big shift I definitely noticed after the fusion was tightness in the hips.
Yeah.
Just because there was nowhere else to take the impact.
Yeah, and tightness in the hips, tightness in the back, sometimes tightness in the obliques. You know, she's kind of like, again, you know, just lost some of the ability to side flex. So like these muscles, and the low back muscles, the QL and stuff like that, they're going to stay tight. So it's going to be kind of like constant treatment just to help loosen stuff up. Constant attention to flexibility, sitting patterns, walking patterns, so that we can get as much healthy movement down into the SI joints as what she's supposed to have. Bend this knee up. So we're going to say right leg is right here. It's about 2 inches away. And before we do any stretching, let's see what the left side looks like. And this is like way easier.
Yeah, that's easy.
Yeah. So we got heel to butt, no problem on this left side. Back down. Bend up here. And just with a little bit of stretch on the left side, this right side already loosened up a little bit. Push into my hand here. And stop. Let's push a little harder. And stop. And when we do this AIS, or push one more time, this PIF stretching, push and stop, and push and stop. We're trying to position her foot into this release position, this toe in, heel out position, so that we can get maximum quad, hip flexor, you know, proximal and distal. Proximal's close up here to the front of the hip, distal's down by the knee. So we get maximum hip, knee flexion. Push, stop. Push, stop. Push, and stop. Push, one more time, and stop. You guys see we're getting closer. Push one more time, and stop. Closer to her being able to sit comfortably on this right knee. But let's check the left side now. Bend up here. Push, and stop. But this side can go way up. Push, and stop. And push, and stop. Nice work. Back down. Okay, let's see what the sacrum wants to do. How's left side feel?
Fine. It's just the right hip that's usually tight. Yeah. I think it's from driving.
Yeah, I feel that a little.
Yeah.
So still just a little bit of tension, a little bit of muscle tightness, a little bit of soreness probably as well, right?
Mm-hmm.
Okay, cool. All right, here we go. Thoracic adjustment. Head's gonna go back. Nice. We're gonna start up here high in the T-spine. Take deep breath in. Exhale down, way down for me. Nice, 1, 2, good. Breath in. Exhale down for me, whole way down. 1, 2, good. Breath in, one more time, kid. And exhale down. 1, relax here. 2, good. And what we're doing there, little rotation, just very light. You okay here with this?
Uh-huh.
So when we lift the hip up and we compress or press down through the rib cage, we're trying to just gently induce or create a little bit of rotation in her posterior chain, in the rib cage, and help get a little bit of flexibility. I'm going to lift you up through here. And right here. Good. Back down for me. Nice work. All right, starting down in the feet. Ashlyn's got awesome plantar flexion. Super easy plantar flexion. Toes point down, feet point down nicely. She's worked on some shin splint tightness in the past, a little bit of tension down through the peroneals. Squeeze your toes down for me. You can see how much she can kind of grip and rip, right? We say grip it and rip it. Squeeze left foot, squeeze right foot. She's working on plantar fascia activation. This is a great exercise to help the posterior chain, the calves, the plantar fascia, to strengthen and stimulate movement and healthy flexibility down here in the ankles. Good, relax for me. Left ankle is good. Relax here. And right ankle is good. Nice work. And already just with a lot of her flexibility at home, a lot of her stretching at the gym. She doesn't have a lot of restrictions in the lower extremity, which is nice. Her mobility is good. She's flexible in the toes. Good, right there. Relax here. Bend here. Easy here. That side's good. And now easy here. And 1, 2, relax that. Good. Okay. So as you guys have seen, double foot press. Hold right here. Nice. And Bree, if you want to kind of take she's actually really nicely balanced today. Squeeze feet together. Yeah, you go. Progress. Gently twist left knee open. Hold right there. Feel those muscles up in the left leg work. Gently twist right knee open. Gently twist left knee open. Nice. Squeeze feet a little bit. Good. Can you feel how this is working like your adductors up here gradually?
Yeah.
Okay.
This is so hard for me.
So hard. So this is our double bow set lay. You guys have seen this on a couple videos in the past, but left knee opens up gradually. Twist the left knee. Yep, right there. And then twist the right knee open gradually. This is a nice lying exercise, and it helps us to kind of decompress the front of the hip. Do you have any strain up in the front of the right hip at all, or no?
Yeah, usually it's pretty constant, but like I said, I think it's the only place that can really absorb that impact. I also drive a ton, so I think it's from driving.
Yeah, so sacrum gets a little imbalanced, muscles up in the pelvis get a little imbalanced. This is a nice laying position when you're in bed to just kind of like chill out in, gently focusing on the left knee opening up and feeling those left hip muscles up into the left leg work, and then gently twisting the right knee open and kind of seeing how that side seems to be a little shakier, a little weaker, a little more unstable, or it has a little more instability. And you'll see how those guys, like, they just twitch a little bit. Good for the plantar fascia, good for the posterior tibialis, the calf muscles. Let's go double knees open gradually right there. Squeeze feet together strongly. And this is a nice little easy exercise to work on laying in bed to really help strengthen the pelvic floor and some of like the diamond muscles up there in the hips, the iliopsoas, some of the low back muscles. Okay, cool. Relax for me there. All right, let's go back up into the cervical spine. We already did muscle work, a little bit of myofascial release. We're going to twist gently to the left. Beautiful. We're going to twist gently to the right. Relax that neck. Nice job, kiddo. And now into the arms. What do you think the hardest thing was after surgery?
So I think for me it was unique because they overdosed me. So I don't take medication well, and my body just couldn't handle it. So immediately after surgery, I had just woken up and I was in a lot of pain, and they were giving more morphine, and they overdosed me, and I stopped breathing. I was in the ICU. Yeah. my parents were there, my grandmother was there, so they watched me stop breathing, and all the nurses come in like running, freaking out. But for me, the hardest part was the drugs. I hated them. I did not get that. I will never be a drug addict. I will never be addicted to pills because I did not get that euphoria from it.
Yeah.
It was definitely
Sickness.
a downer. And I was just depressed. Like, I was so sad all the time. They wanted me on the medication for over 6 weeks. At my 6-week checkup, they asked me if I needed my Oxy refilled, and I said I got off of my Oxy a week after being home. I was in the hospital for a week. After my first week home, I got out of it because I was like, it's making me sad. I could literally take the pills and say to my mom, in like 20 minutes I'm gonna be crying, and I would. It was just, and for no reason, like I was just sad. It just made me sad, and like I was taking Valium. I was taking liquid Valium because my body couldn't handle the dosage for pill Valium, so I was taking baby Valium, and that tasted like gas, and it made me sad. Like, there was nothing that they could give me that didn't make me just cry all the time.
Depressed or like.
Yeah, so obviously the pain was bad, and that's to be expected, but what I never expected to happen was to like just be really depressed 2 weeks after for no reason. And now I really don't remember a ton of it now because I was high the whole time.
Doped up.
Yeah, but
I'm so sad.
that was just something that I didn't think was going to happen. So I guess that would be the hardest part, because you expect to be in pain. Another difficult part of it is that I couldn't bend, twist, or lift for 6 weeks.
Yeah.
So you have to really focus on like how do you get out of bed? I had to log roll out of bed every day, things like that. For a spinal, I mean, it's an orthopedic surgery place that I went to, and the chairs in my hospital room were awful. Like, I could not sit in them at all. I could not get comfortable no matter what, and that's still something that I have to work with today. Is like I can't sit in a chair that everybody else can sit in now and be comfortable in it. Like, I usually have to I drive with like a special foam insert in my car because my back doesn't bend the way to fill into a chair anymore.
Yeah.
So usually if I'm sitting, there's about 2 or 3 inches, I'm just sitting like straight. Like, for some reason I can't lean back into a chair anymore. So stuff like that, which is just something that you have to get used to. But I wouldn't say it was difficult. For my first 3 months after recovery, we had this really gross, really old electric lift chair. That was the only thing that I could sit in because it was made for old people, so it wasn't squishy. Like, I can't really sit. Couches that are really squishy and like comfortable that you can sink into are my worst nightmare because I can't get out of them. Like, I'll sit and I'll be so uncomfortable, and then it'll be time to like, okay, get off the couch, and I'm like log rolling to try to get off the couch. It's just
I can't get out.
yeah, it's like I can't do that. So just things like that, but nothing was really
too bad.
It was just like you're having a spinal fusion. Like, it's gonna be bad, you know?
The side effects of the medication's the worst.
Yeah,
right?
that was awful.
And then the willpower to get back to moving, right?
Yeah, that was something that me and my mom had really taken initiative on, because when we decided to book the surgery, she had said to my surgeon, okay, well, you're gonna write her a script for PT, right? She needs pre-surgery PT, she's having a spinal fusion. And he's like, oh no, we don't usually do that. And she's like, well, is she gonna get post PT? And they were like, no. And she's like, yes, she is. Like, you're gonna write her a script for both of them.
Yeah.
And they did. I mean, it's not something hard to do. And I did pre and post PT, and I really think that helped a lot with my balance, because it's a whole new ballpark. I really can't do the same things that I used to do. I just do it differently now, but you have to figure that out, and I feel like that's a reason why so many people are like, I can't do things now. I had this big surgery. It's like, no, you can. It's just you have to work on.
You gotta alter it,
okay,
right?
yeah, I can't bend over like this anymore to pick something up. That doesn't mean I'm gonna use a picker-upper for the rest of my life. Like, no. Yeah,
The claw.
you're gonna figure out how to do it.
Yeah. See how this head feels here? That
tight.
A little sore?
Yeah, that's much worse.
Way worse,
That's
right?
so much worse.
So we know the right hip, the right leg, you know, she's really super close to super balanced out, to really nice balance. We may never obtain it in the right leg. We might never obtain like full balance between the right side and left side. But there are a number of things, and what we're checking here is like some of the intrinsic foot muscles, the plantar fascia. You know, left side's a little softer. She definitely has some tension over on this right side though, right? So rolling the foot out is going to be an important factor on a lacrosse ball, and just kind of like self-treating some of these muscles. The foot squeezes, getting the left plantar fascia to pump up, the right plantar fascia to pump up, the foot presses where we press in, all good exercises to help keep the lower extremity nice and mobile. Over in the gym, back to weightlifting, lunging, squatting, doing some deadlifts, some running, lots of kettlebell work, and all of those things that she's totally capable of. Cool. Let's sit up tall for me. Spin to the right. And then we're going to finish up, guys, just with a little shoulder exercise, or a little shoulder adjustment, I should say, right here. Nice. And one more here. Nice job. All right. So there is our treatment with a person, a patient, a friend who has had scoliosis surgery that went from about 24 degrees up to like 50 plus degrees. 18 screws, rods in the back, still is a great patient. We can do muscle work, we can do soft tissue treatment to the scars, to the keloids, the keloid formation, the scar tissue formation. We can definitely exercise, we can definitely work out, we can definitely stay active, right? Thank you.
Thank you.
If you guys have any questions, put them in the comments below, we'll answer them, and we'll see you guys on future videos.